Hello. I would like to discuss the variations in facelift incisions. You all hear about all the different techniques, and a lot of doctors, especially in America, like to use specific terms, and they kind of make it their own trademark term, and it's very confusing for the patient. Now, at the end of the day, what's important is what we call a deep plane facelift. So it's a facelift that includes two layers, the muscle and the skin layer. So this is very important in most facelifts we do. Now, there are different ways to achieve this, and the incisions can vary a little bit different depending on the techniques, depending on the patient's anatomy, and depending on the way the patient aged. So I'll start with the smaller to the larger incision. The short scar facelift, very popular in New York City 15-20 years ago, always with the two-layer facelift. But the short scar facelift was an incision in front of the ear, around the tragus, which is that piece of cartilage, and I will talk about this one in a few minutes, around the lobe, and just behind the ear. It works well when we don't have a large excess of skin. The slight geometry problem with this one with a large excess of skin is we have a smaller circle with a larger circle of excision, and we end up having too much skin to bundle together to close. Patients end up with some folds behind the ear, which most of the time will go away over 3 to 6 months. But if the excess of skin is too great, usually we have to convert this into a more classic incision, which extends behind the ear into the hairline. That's the more classic incision. To this classic incision in the front, we can add a component. You can imagine when we pull skin and lift up, it creates a bit of a bulge here. We call it a bit of a dog ear. And there are two ways to get rid of this. One is to cut under the sideburns. The other way is to continue a little bit higher in the hair-bearing scalp. Now, if we have a patient with very low sideburns, ladies with low sideburns or male with low sideburns, we can continue up. When we pull up and back, we're going to raise the sideburns a little bit, but as long as we don't raise it too high, it still looks nice and healthy and youthful. Now, we have many ladies, I'd say 50%, 60% of my ladies, and all the ladies who've had a facelift already before, their sideburn is already on the high side or already at the base of the helix. So this is the base of the ear or the helix. If the sideburn is already there, we don't want to bring it higher with a traditional temporal incision. At that point, we have to do what the Brazilians quoted as a peninsula technique many years ago. So the trade-off to get rid of this dog ear when patients have a high sideburn is to go around the sideburn and back into the scalp. That will allow us to remove skin here and not to lift the sideburns too high. A sideburn that's high looks more masculine and older. So although we always think of facelift in the front view, it's very important for us, plastic surgeon, that it looks good both in the front view but also on the profile view. Now, there's another technique called the MAC facelift, M-A-C-S, which is more a technique I use for patients where there's more vertical drop, not so much an anterior drop. So there are a few patients where the soft tissues fall completely down. They're very heavy here, and it seems like the vectors of forces are almost vertical. They need a full vertical lift. So the MAC facelift starts in the back of the ear, goes around the same way we've talked about, can go straight into the hair or in front of the peninsula temporal hair, and that is what we refer as a MAC facelift. It's a common technique done by the ear, nose, and throat surgeons, but sometimes I apply it in my practice when it's required. Now, a small nuance I like to mention is the tragus. The tragus is that little piece of cartilage we all have here. A good plastic surgeon who wants to hide the scars as well as possible will usually put the incision behind a little bit at the entrance of the ear canal just to hide the scar, so there is no straight line in front of the ear. If you wait at the bank or the grocery store and you look at people on the sides, the idea is to not catch attention with a straight line. So for all our ladies, we go behind. For our males, it's a discussion I have with them. I have some patients who have already multiple lines here and they're okay with one left there from the scar. The downside of going behind the tragus in a male is I'm going to bring some hair-bearing skin onto the tragus. Now you'll tell me many men have hair on the tragus, and yes, that's what I tell my patients, but there are still some patients who are not interested in having hair on the tragus. There are patients who are not interested in doing laser hair removal on the tragus or not interested in doing electrolysis, and for those patients we will go in front of the tragus. So we talk before or after the tragus and under the sideburn, around the sideburn, and into the scalp. Those are the little nuances that I discuss with patients, and often patients will have a say in their scars. Thank you.